What if I told you the key to curing certain diseases isn't science? I'm Rachel, I'm a public and social policy consultant, and I want what I know to be what you know. And I've said a couple of times before that public policy is social psychology at scale. And today I want to talk about vaccine hesitancy. Why do I want to talk about vaccine hesitancy? Well, in the UK, measles is on the rise. And over the last couple of years, we've had more than 3,000 confirmed cases of measles. We've lost our WHO, a World Health Organization rating, as a country that has eliminated the measles. We are no longer classed as a measles-free country, and our vaccination levels are low. And when coverage drops below 95%, which is the level at which we as a community can class ourselves as having herd immunity, then as well as a medical failure, this becomes a major public policy failure. And when it comes to vaccine hesitancy, when we take a public health approach around people not quite understanding the science, we've already lost and we've already misunderstood the problem. Because vaccine hesitancy is not about science, it's about psychology. It's about identity and it's about trust. Now, the issue when it comes to understanding why people are resistant to following the science is a wicked complex problem. And this problem is what we would call a wicked problem because it's not one group, it's not one belief, it's not one reaction. In fact, in policy terms, we talk about these groups as different coalitions of people or of organisations or of identities that group together to form a particular stance. But within these coalitions, within these groups, there are multiple different sort of oppositions to a public policy, in this case, vaccinations. And when we put them together, we call it a policy subsystem conflict. Pretty dry sort of terms for what we're dealing with here. But basically what we're saying is it's not that you can't just go out and vaccinate people. You kind of, when it comes to something like vaccinations, it's cheesy as anything, but it's hearts and minds, not brains and science. So if vaccination policy is not about science, what is it about? Well, when it comes to our identities as social beings, our core beliefs override certain instructions that we get, particularly from institutions of authority. So vaccine policy and public health policy isn't actually about science, it's about trust, it's about autonomy, it's about our really core beliefs around things like disgust sensitivity. It's heavily interwoven with conspiracy mentality, anti-government sentiment, and individualism and individualistic behaviours. There's also a concept called psychological reactance, which is a kind of a technical term, but basically it boils down to don't tell me what to do. But when we have a high degree of psychological reactance, a high level of don't tell me what to do, then when we be bombarded with messages, particularly public health messages, particularly when it coincides with kind of conspiracy theory mentality, it compounds in order to people becoming more and more entrenched, really digging their heels in their position of do not tell me what to do. I'm an individual, I'm autonomous, I do not trust you. So these individualistic worldviews are not linked to intelligence, they're not linked to a lack of information, they're linked to our very core beliefs as humans. And so just repeating evidence doesn't work. And when it comes to policy and when it comes to getting masses of people to behave in a certain way, because that's what public policy is, social psychology at scale, it's how do you get large numbers of people to behave in very particular ways in order to achieve a specific outcome. In this case, we want to eradicate measles, so we need more people to vaccinate their children. Now, giving them more science isn't going to work, so what are we going to do? There's a large body of evidence that says that we need to focus on identity-based assurances. And identity-based messaging works well when it confirms someone's core beliefs or it plays to them, right? It even just acknowledges their core beliefs. So when we say things like you must vaccinate in order to protect society, we're neglecting that sense of individualism that people and the autonomy that people want to feel. But if we were to switch that messaging to something along the lines of vaccination keeps government restrictions away, high uptake prevents lockdowns, stops schools closures, and it stops us from having vaccine mandates. If we were to frame it as preserving normal life or even minimizing state intervention, then you're able to appeal to that state of it, that sense of institutional distrust, whilst feeding the need for autonomy. Now, adding further complexity to an already complex situation, vaccine hesitancy and the distrust of governments and organisations is deeply rooted in marginalised communities, in colonial histories. structural racism, unequal treatment, and poverty. Capitalism has done a number on us in every aspect of our lives. So if our strategy for vaccine hesitancy is to shout, trust the science even louder, then we're just not doing public health, we're doing theatre. And we're becoming as entrenched in our messaging as the people who are as entrenched in their anti-vaccination sentiments. And so public policy and public and social policy consultants like me, we look at identity rather than scientific measures, because we know that the social psychology at play is rooted in identity, in these coalitions of people who group together around things like trust and our core beliefs. So vaccine hesitancy is not a compliance problem. It is a belief system negotiation between the state and the individual. But in the UK, we are absolutely not doing this well at the moment, because if we were, our vaccination rates wouldn't be as low as they are. And we wouldn't have children in hospital today with a disease that has been curable for decades. But I think vaccination policy is a really good example of how social psychology needs to play a greater role in public and social policy. And I also would like to say, I know that the people who work in public health do an extraordinary job and are working as hard as they possibly can. Nobody thinks that anti-vaxxers are purely ignorant, don't believe the science, and are lunatics who, are just distrust absolutely everything. That's not the case. But when we appeal to identity and we understand the psychology at play, public health and public policy becomes more impactful. And for the sake of the children in the hospital at the moment from a completely curable disease, we need better policy.